This electron micrograph captures the baseline ecosystem of healthy bone marrow. Red blood cells, platelets, and white blood cells operate in a tightly regulated, balanced environment. Among these are plasma cells, the body's dedicated antibody factories. Their sole function is to produce targeted immunoglobulins to identify and neutralize infections. The disease begins with a single genetic error. One plasma cell mutates, goes rogue, and aggressively clones itself. This initial stage is known as MGUS, or monoclonal gammopathy of undetermined significance. The rogue clones produce a low-level paraprotein of less than 30 grams per liter, but they cause absolutely zero tissue damage. Throughout this phase, the host feels perfectly healthy. They remain completely unaware that a biological sleeper cell has taken root in their marrow. This chart tracks the reality of MGUS. Approximately 1% of cases progress to multiple myeloma each year. Over 20 years, this probability steadily builds. When rogue clones multiply to 10% of the bone marrow space, the condition crosses into smoldering myeloma. Even at this 10% infiltration rate, the patient still experiences no outward physical symptoms. The cancer is quietly massing an army, securing its biological footprint before launching a systemic strike. The tipping point occurs when malignant cells breach 20% of the marrow space. This marks the transition to active, symptomatic myeloma. The cancer begins its takeover by physically anchoring itself. Myeloma cells adhere directly to the bone marrow stromal cells. This physical connection sends a chemical signal that blocks apoptosis, the mechanism of programmed cell death. By turning off their own self-destruct sequence, the cancer cells render themselves virtually immortal. Once anchored, these cells trigger a massive cascade of cytokines, flooding the marrow cavity with inflammatory signals. The cancer has actively hacked the local stromal environment, forcing the body's own biological infrastructure to protect it and fuel its expansion. This chart displays serum protein electrophoresis. The massive M spike represents a flood of excessive, useless monoclonal proteins pumped out by malignant factories. Alongside intact proteins, cells turn out incomplete fragments called light chains, which break off and flood the circulatory system. Concurrently, the production of normal, healthy background immunoglobulins completely flatlines. The body's immune resources have been entirely hijacked to produce biological pollution, setting the stage for multi-organ failure. The biochemical assault hits the skeleton first. Myeloma cells secrete a protein called RANK-L, which hyperactivates osteoclasts, the cells responsible for dissolving bone tissue. Looking at this MRI, you can see the dark infiltration and collapse of the L3 vertebra. These are lytic lesions, punched-out zones where bone has dissolved, causing severe fractures. As this dissolution spreads across the skeleton, massive amounts of calcium are dumped into the bloodstream. This calcium flood causes hypercalcemia, triggering extreme back pain, vomiting, and severe neurological confusion. Simultaneously, the toxic light chains, Bence-Jones proteins, travel through the bloodstream and reach the kidneys for filtration. In this histological view of the kidney, the pink material distending the tubules this precipitated protein. The light chains physically clog the filtration system, causing acute renal failure. Back in the marrow, the physical mass of multiplying plasma cells crowds out healthy hemopoietic tissue. Red blood cell production stops, starving the patient of oxygen and resulting in profound anemia. Hypercalcemia, renal failure, anemia, bone lesions. This is the Crab criteria, the defining clinical signature of a body under systemic siege. Tracing this exact molecular roadmap from a silent, localized sleeper cell to a total systemic collapse has allowed modern medicine to design targeted therapies capable of dismantling the insurgency.